The Marty and Laura Show is brought to you by Veterinary Village. With locations throughout Wisconsin, Veterinary Village is dedicated to enhancing the quality of animal and human lives today and into the future.
Welcome to the Marty and Laura Show. Marty and I are back, and tonight we're going to have a little change of pace. We've talked a lot about dogs, and we promised you that there would be cats. And so, though I literally know that cats exist and have little whiskers and purr, that's the extent of my knowledge. But Marty, on the
good
other
heavens.
hand, it's literally what I got. Marty knows a lot. And so tonight we have a really, really important topic for everybody. We're going to talk about blocked cats. Is that what we're talking about, Marty?
Blocked, plugged, FUS, feline lower urinary tract disease. There's a jillion terms for it, but yes, we're going to talk about cats with urinary tract issues.
And we're going to talk about it because you literally were late for a recording session because you were dealing with a really urgent situation in a client in your clinic today.
Yeah. Yes. Okay. So blocked cats, obstructed cats, FLUTD, feline lower urinary tract disease. It used to be called FUS. We talk about ash in the food. There's all kinds of stuff. But cats have a very serious medical condition when they cannot urinate. And you can only imagine how A, painful, and B, dangerous that is for cats. And it's almost always male cats. I can tell you, I can count on one hand the number of female cats I've seen obstructed, but male cats pretty commonly. It accounts for about 3% of all veterinary hospital admissions. So it is a common disorder.
Like across the country, across the board?
Yeah.
Of every 3% thing there could be wrong with any animal?
Yeah.
Wow.
And the problem is there's a lot of misunderstanding about it, not only with clients, but also with veterinarians. Mm-hmm. So it's kind of a complicated disorder. We've known about this for years and years and years and years in cats, like forever. Back in the old days when cats didn't live in the house, they lived in the barn, they lived outside, whatever. They probably still developed this, but they would not be able to urinate, and then they would go off and they would probably die because they didn't live with you. Mm-hmm. But now that cats live in our homes, we start to see things that alert us to the fact that the cat has a problem. So if you have a cat that's urinating inappropriately, male or female, blood in the urine, not in the litter box, straining to urinate, and it can look like constipation. So that's where it gets to be a little confusing sometimes. If you see a cat with that, your cat is sending you smoke signals, poof, poof, like poof, poof. Take me to the vet. I have a problem. I need help. And antibiotics are not the solution for this. So that's where it, I think, becomes really confusing, is that we think as clients, we think this is a bladder infection, but cats don't get bladder infections the way that other species do.
Interesting. Okay, before we go any further, I do have to introduce to our audience Emmylou, who has
a dog
joined us this evening. Emmylou is a Danish-Swedish farm dog that Marty bred, and she clearly is feeling some of Marty's anxiety from tonight's late night and struggles, because she will not leave Marty alone. So I just want you guys to meet Emmylou and know that dogs make everything better, even when we're talking about cats.
Yes, so she's sorry she's not a cat. She wishes she had ears that stuck up and that she could purr, but she can't. So she apologizes to everyone. She's the size of a cat, but she's not really a cat. So, and I don't know why she's acting like this. It's kind of weird because she's normally not like this. And I'm not really that stressed because plugged cats are that common that it's just like my first year out of vet school. I worked at an animal emergency clinic in Milwaukee, and plugged cats were just, we saw them all the time. So I'm pretty good with plugged cats. Not every veterinarian has had that many cases of it that they're really comfortable with managing it. So anyway, so the most important thing I think you realize is that if your cat's not using the litter box, you need to get in for veterinary care. And people think that their cat missed the litter box. Cats don't miss. If you watch them in the litter box, they dig a little hole and then they turn around and they look and then they dig a little bit more and then they look a little more and then they dig a little bit more. And then when they finally urinate or have a stool, it is nailing it right where they dug the hole. So cats don't miss. If they're not using the litter box, you absolutely positively are getting the advance notice from your cat that I'm going to be in trouble and you need to get this fixed fast before something goes wrong. And this particular cat came into us yesterday, but in the amount of time that elapsed, in the 18 hours that elapsed from the time I saw him to yesterday to today, the cat developed an obstruction.
Oh my
So
God.
it is serious, it is life threatening. And when a male cat cannot, or a female cat, mostly male cats, cannot urinate, it is a medical emergency. You cannot diddle around and wait till you get around to taking them in. This is a life-threatening emergency because the waste products build up in the blood. The cat becomes azotemic, so their BUN and creatinine go up. They get really sick. They start to vomit. The potassium level goes up. It slows down their heart. If the bladder ruptures, then you're really done. So you cannot wait on this. And just going to the vet, taking a urine sample and saying, here it is, can I have an antibiotic, is not a solution. The cat needs to go in, the cat needs to see the vet, they need to see what kind of crystals are in the urine, because there's two general kinds. There's struvite, which are magnesium ammonium phosphate, and there's calcium oxalate. And again, the microscopic exam, which can be done with artificial intelligence, with the SediVue, with the Imagist. There's a number of pieces of equipment that use artificial intelligence to analyze this, can tell you what kind of crystals are there, and based on that, make an appropriate dietary recommendation, because the backbone of treating this is a dietary change. It is not
Interesting.
medication. Yeah,
Okay.
it's very
So
interesting.
so in dogs we see similar kind of things, but this is much more specific to cats, right?
Dogs develop bladder infections from bacterial infections.
Mm,
Cats almost never, as a primary problem, have an infection. They
mm,
can end up with it secondary to a catheterization. They can end up with it after they've been undergoing treatment for multiple episodes of this,
right.
but it is not a primary bacterial disease in the cat. So an antibiotic is not the hallmark of treatment. And that's where a lot of people get confused. And again, we get back to, well, as a veterinarian, do I need to just do something for the cat? Well, the do something really should be a diet change and not an antibiotic, because it's rare that the antibiotic is going to solve the problem. So we've come kind of full circle in veterinary medicine. Things have changed a lot in how we look at bladder disease, especially in the cat. Is just because you see bacteria in the urine doesn't mean the cat is going to need an antibiotic. We can see bacteria. We used to say the urine should always be sterile. There should never be bacteria there. And now, if you talk to, especially the internists that really understand a lot about urinary tract disease, seeing bacteria in the urine does not mean that the cat needs an antibiotic. You have to also see accompanying white blood cells and symptoms to say that it is appropriate to put the cat on antibiotics. So do not just ask your vet for, can I just have a bottle of amoxicillin or Clavamox? Can I just do that? Do I really have to bring the cat in? The cat hates to get in the carrier, hates to come in.
Mm.
The answer is no, you need to come in.
Okay. So when I bring my cat in and it can't pee or it's peeing in the wrong spot, you're going to do what to diagnose that?
Well, I would like a urine sample. And in my practice and the practice of a lot of veterinarians, we're going to use an ultrasound machine to take a look at the bladder. Are there crystals in there? Are there stones in there? Are there blood clots? Is there a polyp or tumor? Anything else going on in there? And then we're going to collect a urine sample with ultrasound guidance directly from the bladder with a needle and syringe. So we have a sterile urine sample. Dogs and cats don't wipe front to back. So when we collect urine samples, they're not going to be sterile if they are voided. So we really want to sample directly from the bladder. And it kind of freaks out owners, because if you think about laying on an ultrasound table and somebody putting a needle into your bladder, it can be a little like it kind of scares you. But the dogs and cats, puppies are a little hard because they don't really lay still for anything. But most adult dogs and cats, we just lay them on their back. We put the probe on with one hand, put the needle and syringe with the other hand, whoop, in the bladder, pull out 12 cc's, and we're done. Like, it doesn't seem to bother them much because they don't have this preconceived notion of, really? You're sticking a needle into my abdomen? And the standing joke in our practice is I'll be looking in the dark. I'll have the probe in one hand, I'll have the needle and syringe in the other. And the standing joke is as soon as you hit the bladder, my staff will say, "You're in." And does that mean you're in the bladder and you're collecting a sample, or you got urine? So they giggle
Okay, that
every
is the
time they
worst
do
of
this.
the dad jokes ever. Just
Ever.
FYI.
Totally. Totally. They giggle every time they go, "You're in." So, because it's kind of hard to tell in the dark if you're
Yeah,
seeing the urine.
right.
Now, if you've hit it, nailed it, you know, the urine flows into the syringe pretty freely. But if you're just sort of barely in,
Right.
it can be hard to tell just pulling on the barrel of the syringe. And so, unless you've ever
And
drawn
so
urine or
you're in
blood
the
samples, you
dark.
don't
So
really get it
for people
in the dark,
who've never done an ultrasound, you're usually doing that
in the
in a
dark.
darkened room because that allows
Right.
you to see the monitor on the ultrasound.
Exactly. Exactly.
Okay.
So just remember that giggle of, yeah, my staff is giggling,
Right.
not because they're happy about your dog or cat having a problem, because every time they do it, they know it sounds so
The
funny.
worst dad joke ever. Okay.
Totally.
Okay. So you do the pull from the bladder, which I know there's a name for, and it's not coming to me right now.
Cystocentesis.
Yes, that. And you're going to look at that under the microscope to be able to identify, like you
Yes.
said, crystals, anything else weird that's in there. And then is there, I mean, what do you do? I mean, a diet change is going to take a minute to fix the problem. So if the cat is
It's
blocked, how do you fix it?
right. If the cat is blocked, they stay in the hospital. They need a urinary catheter placed. Most of the time, that's an anesthetic procedure. Depending on how cooperative the cat is and how sick the cat is, that's typically anesthesia. If their potassium is really high, it's risky because their heart rate is affected. It's lower, and it's a higher risk anesthetic procedure. And if the cat has been obstructed for more than 24 hours, the urine looks like port wine colored. So it's not just a little bloody, it looks like that dark maroon color of port wine. So we can pretty quickly assess how long the obstruction has been there.
Mm-hmm.
And those cats get really sick because their waste products build up in the blood, the BUN and creatinine, and their potassium goes up. And it's just, these cats are a hot mess. So we really try to get these guys in as soon as possible. So if you're seeing anything that doesn't look right to you with the urinary tract of your cat, go in and get the diet change, because you're right. The diet change works fairly quickly, but it's not going to act immediately. And you need to get this under control, females and males. So most of the time we see this in young cats between 1 and 3 years of age. Almost always males if they're going to have an obstruction, but females get the same disorder. They still get feline lower urinary tract disease. They just don't usually obstruct. And it's most common between December and March.
What?
Guess what month it is? It's January.
What? Why does that have what? Why?
As the days are shorter, the cats sleep on the couch. They might move as the sun moves across the couch, but they don't get up and go to the litter boxes frequently. They're just hanging out because it's January, it's cold, it's dark.
Too cold to pee?
No, but they don't see any reason to get up. Cats might only urinate twice a day, and the longer that the urine sits in the bladder, the greater the chances are that it's going to form crystals, precipitate out, and cause the crystalline material that causes the obstruction. So, why would you get up if you didn't have to? You're a cat.
Why you?
Like,
Okay, so
like,
you know
why
that
would I go
Marty's
anywhere?
goal in life is to make my brain blow up. The cat
Once
gave
a show.
itself crystals because it was too lazy to get off the couch. Might have just blown my brain right up. Sorry, cat people. I don't get it. I don't understand.
They're cats.
I'm sorry.
Every
wow.
show I have to do this at least once with
Okay.
Laura.
Yep,
Every
yep.
show I have to do something that she goes, "What?"
What? What? Any
So I'm full of
difference
trivia.
in impact to intact or altered animals?
Not much that we think of. There was a theory a few years ago that if you neutered the cats really young, the males especially, that they would have a more narrowed urethra, but that's pretty much been discredited. But it's almost always male cats, because males, as females all know, all of us girls know that males have a design flaw,
Yes.
that they have this skinny urethra that goes over the crust of the pelvis and through the penis, and it goes into these places that makes the obstructions more likely to happen. Females have a short, wide urethra. They can put more pressure on the bladder. They can push out some of this crystalline material, the small stones, that kind of stuff. Males can't because they have this narrowing in the penis. And, the guys think that that's not a design flaw. They think that's an attribute, but I think it's a design flaw. So that's, again, just a personal opinion and clearly one spoken by a female. Sorry, guys. I hate to discriminate against you, but that's the problem. So male dogs.
Cats, dogs, I mean, it's all, everybody's got a different
right perspective.
Yeah.
But like every species that, all the mammals that have a penis are more likely to obstruct in the male than the female. There's a thing with sheep, a ram, and they have this projection off the end of the penis that when they urinate, it kind of spins around, and it can get a stone in that. And my son had a lamb that died from the obstruction. So
does that happen?
It's not just
boy sheep, because I have 2 boy sheep. Now I'm freaked out.
Yes.
What?
It's the urethral process, and yes, they can obstruct. So yeah, the males are always at greater risk of an obstruction. They're less likely to get a bacterial infection because it's harder for bacteria to get up there. But if they have a stone, it's more likely to cause them a fatal event or a serious event. So yes, males have this design flaw. So that's the story on that. So diet is really important. And a lot of people think that they can just go to the store and buy something that's equivalent to the prescription diets, but prescription diets are really the recommendation for cats with urinary tract disease. Now, there's a lot of prescription diets on the market. There's things for kidneys, which are different than bladder, and there's heart and intestinal and, skin and all kinds of stuff. So a lot of people ask why prescription diets have to be only sold through veterinary clinics. And the answer is because there's 50 different kinds of prescription diets, and you need to make sure you get the one that's actually treating the correct condition for your pet. So the things that the prescription diets do for urinary tract disease in the cat are they adjust the pH so that it's less likely to be too alkaline or too acidic. And alkaline urine will cause struvite stones to precipitate out, and acidic urine will cause calcium oxalate stones to precipitate out. So we want to have the right pH. And these foods have a lower amount of, like for triple phosphate stones, that's magnesium, ammonium, and phosphate, less phosphate in them. And the calcium containing diets will have less calcium in there, so that they're enough to keep the pet healthy, but not so much that they cause the stones to precipitate out and cause crystals, which then turn into stones. It's like the oyster with the pearl in it.
Yeah.
Like a little sand gets in there and it starts to form a stone, and then the more irritation there is, the bigger the pearl. Well, pearls are valuable in the oysters, but they're not so good in the bladder. Not good in the bladder.
Doggett simplifies the puppy buying journey by connecting families with the perfect breed and responsible, health-verified breeders. They are the only breeder marketplace that verifies health clearances and responsible breeding practices. Through their personalized puppy matcher tool and matchmaker services, they educate and guide buyers every step of the way, ensuring a seamless process and a perfect match for their lifestyle. From initial breed consultation to introductions with top breeders, Doggett makes responsible puppy ownership easy and stress-free.
We all know somebody that's had bladder stones, human peoples, all men, as I think about it. Who knew?
See? Design flaw.
Yeah, design flaw. Wow, that's going to stick with a person.
Sorry.
No, it's good. How do we, as cat owners, we're sticking with cats, is there a way that we help prevent our cats from acquiring, is there a preventative food or thing? What can we do to make sure our cat never has this happen?
Well, there are over-the-counter diets that help, but if you have a household with a cat in it that has this issue, you need a prescription diet. Royal Canin makes one, Purina makes one, Hills makes one. There's a few other companies that do. Those are the 3 that I typically rely on. And so they do have the right pH. They do have the right electrolyte content. We used to call it all ash. Ash is basically what's left over if you incinerate the food or cremate the food. It's calcium, it's sodium, it's all the minerals. So it's not just about those minerals, it's about the specific minerals that contribute to the stones. So 50 years ago, we talked about ash, but we don't talk about that anymore. So if anybody has sort of a throwback to the old days when we talked about those things, you gotta need to move ash out of the way and continue to look at the other electrolytes
Okay.
and calcium.
So if you've just got, I'm trying to figure out how to phrase this. If you have your average cat, is this cat male or female? Say it's a male. Is there a breed proclivity? Is there any proclivity? Like, who should be most looking out for this particular event? Just random?
Yeah, pretty much. There doesn't seem to be much of a breed predisposition to this. And I was just talking about this. I've thought about this a lot because Carl Osborne, who was on staff at the University of Minnesota for 40 some years, he spent his entire career trying to figure out what caused this in the cat. So it's not bacterial. We used to think maybe it was a virus, maybe it was a mycoplasma, maybe it was bacterial. He spent his whole career looking for the cause of this, and really we don't still to this day know the cause, other than to say we know diet contributes, we know we can control it with diet, but diet per se isn't the cause. However, if you have even one cat in the household that has a tendency to have this, the easiest thing to do is just feed all the cats the same diet. Unless they're pregnant or kittens under 6 months of age, they can eat the prescription diets that prevent this. So if you have a cat or if you're concerned about it, just buy the prescription food. It doesn't cost that much more per day to feed it. And good heavens, if it's safe, because when these cats go into the hospital obstructed, it can be $5,000. So you can buy a lot of cat food for $5,000.
Sorry. Okay. So there's our pro tip for the day. Feed your cat always. Like any cat should eat this don't make crystals dog food or cat food.
It won't hurt them unless they're kittens. Or pregnant and nursing. And then a lot of people feel like the canned food or the wet foods are less likely to contribute because the cat takes in more fluid. Cats are desert animals. They typically don't drink very much. So the canned food does have a higher moisture content. And many cats will only get up off the couch twice a day to urinate. So if we put more fluid in their diet, then we can get them to go more often. Some people will buy those little drinking fountains for the cats because cats like the water flowing, or you can turn the faucet on in your bathroom and let it drip. Or
kitty water, like when we're
you
trying to
can.
get the dogs to drink,
Yeah.
you put broth
Yep.
in it or something.
Yep, you can do all those things. And
Drinking more is
drinking more
also
helps.
a preventative. Okay.
Yes.
The more you
Yeah.
can get your
So
cat to
anything
drink,
you
the
can
less
do.
likely. Okay.
Yeah, and some people just find, some cats like to drink out of the faucet, so you just learn to have it has to be just the right rate, because if it's dripping too fast or too slow, cats are very particular that, like, I can't do that. That's not right. So we kind of people that have cats, the cats kind of run their lives.
Okay. I mean, sure. Sounds like a lifestyle. I'll just run with lifestyle. Great. And so if your cat has had these stones or crystals, it, I assume, then is more inclined to get them again if you don't change your diet, or even
Yes.
if you change your diet, or is there a correlation there?
50 to 80% of the cats will recur if you don't keep them on an appropriate diet. So pay me now or pay me later, like pay me a little bit to buy the prescription cat food. And most of the companies now have a process that you can order it online and it ships directly to your home, even if it's a prescription diet. So you're much better off to buy the prescription food, have it shipped to your house, not have to worry about running out, not have to worry about what if they don't have it when you go to the store, go to the vet, whatever. Just order it, have it shipped, be done with it, and it's going to, in the long run, save you a lot of money. I mean, it's seriously going to be like another 50 cents a day to feed the cat something that's not going to end up creating an issue. So if you're truly cat people, and most of us that have cats are truly cat people.
Cat people.
Yeah. I mean, there are people that have cats and then there are cat people.
Yeah, we feel that way about dogs too.
We sure do.
Okay, so this is really good. my next question, just to kind of broaden the scope a little bit, is there something that isn't this that looks like this in the cat? Right? So you said they don't get
Yeah.
bacterial bladder infections, UTIs are probably not a thing.
Mhm.
Is there any other thing that you're going to think it's this, but it's that?
We can see constipation in cats from time to time,
Mm.
but it's most frequently a urinary tract issue. And then we also have the cats that start drinking a lot, especially in cats as they age, because they're diabetic, because they have kidney failure, because they have something else metabolically wrong with them. So those cats will have an increased water consumption, increased frequency of urination, increased trips to the litter box. But if you're seeing your cat urinating bloody urine in your bathtub, and that's a really classic description, is they went in the bathtub and they found bloody urine. So if you're seeing that, your cat has a bladder infection or a bladder problem, feline lower urinary tract disease, fluted, unless proven otherwise. So again, like most of these things that we've talked about on the show, is if there's something not right, go to the vet sooner rather than later, because in the long run, you're going to come out ahead. Waiting until it gets worse is just going to cost you more money and cause you more
Never
grief.
going to get better.
Not with this. Cats need the attention. They need the food. And if they're sending you that smoke signal of saying, my bladder hurts, I'm going to urinate in the litter box. Frequently in the litter box. I'm going to urinate in the laundry basket. I'm going to urinate on the backpack. I'm going to urinate in the bathtub with bloody urine. Yeah, just go.
Okay, so then final question. You've got this cat in your hospital that is got crystals and is completely blocked. What then is your treatment plan? Is there like a surgical treatment plan? Like in people,
Sure.
they blast them in your bladder. Like what do you do with a cat?
Right. So typically we sedate or anesthetize the cat and place a urinary catheter. Sometimes we can place it, the cat will have the obstruction relieved and they'll urinate pretty freely. Most of the time, the cats stay in the hospital with an indwelling catheter for several days. And on rare occasion, the cat needs to have a surgical procedure. Now, Carl Osborne, the guy referenced earlier from the University of Minnesota, used to say that doing this surgical procedure to remove the penis of the cat was malpractice. But this is a thing. Yeah. It's called a perineal urethrostomy. And so if we have a cat that has recurrent episodes of obstruction because the structural defects are such that the cat can't get the stones to come out, then there's a surgical procedure that it is done to remove that part of the anatomy. It is not commonly done, although I think it's probably done more often than it should be, because most of the time, if we're managing this correctly with diet, it doesn't need to be done. But there are some cats that do have to go to surgery. And again, that's expensive. So it's best to, number one, go in early. Number two, get the right food. And number three, don't cheat on the diet. We know if you're cheating. Veterinarians know, because you're back with a problem. And you think you can pull it off. Like, oh no, I've been buying only the prescription food.
And
oh
so
no, I haven't been feeding
kitty
anything
treats
else.
are bad? Like who knew
They
that
are.
kitty treats were bad?
They are, if you have a kitty with this problem. They make special kitty treats that will help, that you can still feed your cat treats. But because this tends to have the calcium and the phosphorus, we have to avoid the foods that are high in those products, which are going to be the canned fish type products like the tuna, the salmon type of diets. So these diets are more expensive
like regular cat food?
But they have to hand debone the meat to get rid of the bones. So you can't have a machine that debones it. So the cat foods cost more because we have to control the pH and we have to control the amount of magnesium, ammonium, phosphorus, and calcium in the diet. So the meat has to be specially processed. Like you can't have a machine that just, if a little bit of bone gets into regular cat food, it doesn't hurt anything. It does hurt something if we have these cats on prescription food.
Got it. Okay.
So it is more expensive.
Absolute masterclass in cat stuff.
Cat urination.
I am really grateful because when I said I know that they have whiskers and they purr, that literally covers my cat knowledge. So I'm learning with all y'all. I'm right there.
Step
with
up your game.
No, it's okay. I'm good. I have you for that. All right. Well, Marty, next time we'll take on something even more esoteric. God only knows. So thanks everybody for joining us for cat crystals. And thank you, Ellie Mae, for joining us because we think you're adorable. We might have to get you a cat. You might need a cat mascot, Marty. Just
Yeah, I got the cats covered.
Ellie Mae's what you got.
Emmy Lou.
Emmy Lou. Sorry. Oh my God. All right.
You're
Good
close.
night, everybody. Y'all have a great week. We'll talk to you next time on the Marty and Laura Show.
Bye.
Thank you for joining us on the Marty and Laura Show. We're excited to bring you these unique, fun, fact-based conversations about pet health. We hope you'll join us on social. Stop by the website to sign up for an extra tip of the week for your pet. While you're at it, do us a favor, please, and leave a review wherever you find your podcasts. The Marty and Laura Show is produced by Pure Dog Talk, Inc. Sound design and editing by Premium Audio Services.